My name is Gillian Newstead, and today we will discuss the findings of a patient with a diagnosis of triple-negative breast cancer using QuantX software by Clarity Imaging. By way of disclosure, I am a medical consultant to Clarity Imaging, and I serve on the advisory board of Medscape. This is the QuantX indication for use. Please see risk information at the end of this video. The patient in question is an 86-year-old woman at high risk for developing breast cancer greater than 20%. She has undergone long-standing screening protocols with mammography and MRI. At this time, she presented between her screenings with a palpable mass in the right breast. Diagnostic mammography identified an oval mass with indistinct margins at the 1 o'clock posterior position in the right breast, and a skin marker, as I'll show you in a minute, is noted overlying the palpable lesion. Ultrasound correlate identified the same lobulated mass, about 20 millimeters in size, with partially angulated margins which are highly suggestive for malignancy. Ultrasound-guided biopsy yielded invasive duct carcinoma grade 3, and MRI was recommended for evaluation of the extent of disease. So before we look at the MRI, let's take a look at the mammogram. And here you can clearly see a mass very far posteriorly located, and you can see the skin marker overlying the mass. No other significant findings were noted, but the mass is evident and very far posterior. And we can look at the ultrasound, and in this case we can see the mass very well, some lobulated margins, indistinct margins, and this is the biopsy needle in the center of the mass, shown very nicely. Here we'll look at the MRI examination, and we'll start with the first hanging protocol, which encompasses the MIP image and then the 3 MPR images for T2-weighted series without fat suppression. Let's look at the MIP image first. And here we can see good bolus of contrast within the heart, draining veins with lots of contrast bilaterally, bilateral normal nipple enhancement, and a rounded circumscribed mass in the posteromedial right breast. A lot of background parenchymal enhancement is present, and we see an oval enhancing mass, which we'll look at further on subsequent series. You can click on the main mass lesion, and here we see hypointense mass, very nicely noted in location with the MPR imaging. Next, we'll go to the post-contrast study. And here we'll keep the T2-weighted image up in the corner for comparative purposes. And here we can see the enhancing mass. We can look at the kinetic overlay, and we can see mostly the mass consists of washout with some plateau enhancement. And so let's scroll through the images post-contrast. This is the source data set. And we can see a lot of background parenchymal enhancement here and there. And we're going to look at that oval mass that we saw on the MIP image, and here we see it on the left breast. This is the one with some internal septation, we think probably is a fibroadenoma. But let's first go and segment the right breast lesion, and we'll take a look at that. Scrolling through, and here we see the mass. So let's take off the kinetic map for just a minute, and let's segment the lesion. So we're going to press segment and choose the widest diameter that we have here. A little bit of rim enhancement is present. Okay, we'll segment and analyze the lesion. And here we have the results. So we have a rapid rise, and we have a little bit of washout on the most enhancing curve, but basically plateau enhancement. We can look at the volumes, effective diameter, and surface areas, which are automatically represented here. And here we see the QuantX score. The score is 68, which is definitely in the malignant domain, and would certainly have confidence that this is a malignant lesion. And here we're going to finish up by looking at the small oval mass in the lateral left breast. We have already shown the non-enhancing internal septations, and here we're going to segment this lesion as well. We're going to place the seed point and the processing and analysis has just been done. And here you'll see the time intensity curves, which are plateau in nature, which is the most enhancing, and the average enhancing curve, typical for a benign lesion such as a fibroadenoma. And we'll look at the volume, effective diameter, and surface areas are all characterized here automatically. And the QuantX score is noted to be in the benign domain, correlating as a fibroadenoma in the blue bars here. So we, in this case, have analyzed two lesions, the malignant lesion in the right breast and the benign lesion in the left breast. The pathology results of the right breast were as follows: IDC, invasive duct carcinoma, grade 3, triple negative subtype. The immunohistochemical studies show that the invasive tumor nuclei were negative for ER and negative for PR, and the HER2 new by FISH was non-amplified. So that is the classic reason that we have a triple negative breast cancer. The sampled axillary lymph nodes were negative for malignancy. And we also noted, of course, a benign lesion, probable fibroadenoma with circumscribed margins and non-enhancing septations that we saw on the MRI. There was no change in this lesion from 8 prior screening MRI examinations, so that was a benign fibroadenoma. Let's talk a little bit just about the pathology of triple negative breast cancer. The most common basal type gene signature lesion is that of a triple negative subtype. These cancers are found in about 12 to 17% of all breast cancers, and they are always high grade, rapidly growing, and biologically aggressive, reflecting a high mitotic index. Commonly, they're found in BRCA1 mutation carriers and also in premenopausal African American women. And here you can see a pathology slide with the typical lymphoid aggregates surrounding the tumor. Indication. QuantX is indicated for the assessment and characterization of breast abnormalities from MRI data in patients presenting for high-risk screening, diagnostic imaging workup, or evaluation of extent of known disease. QuantX is not intended for primary interpretation of digital mammography images. QuantX is not intended for primary interpretation of digital mammography images. Labeling also provides information to users about potential limitation of the device related to specific subpopulations for use by licensed healthcare professionals only.